and ECOWAS to briefly take her goodwill message. Please welcome her distinguishedly. Your Excellency, you're welcome. While she comes up the podium, we want to also announce that other goodwill messages will be taken in due course. Once again, Your Excellency, thank you for joining us.
Excellencies, distinguished guests, dear members of the NICOM, ladies and gentlemen, my sister, DG of NICOM, the history of Cuba and the entire Caribbean is deeply connected to the history of Africa, especially to the history of Nigeria. Between the 16th and 19th century, more than 12 million Africans were forced into the transatlantic slave trade, and about 4 million were taken to the Caribbean island. Many of them come from the region that is now Nigeria, especially from the Yoruba, Igbo, Edo, and other ethnic groups. Their descendants play a key role in thought of the Cuban nation. Their legacy lives in our traditions, our music, our religion, belief, our food, and our cultural values. The relation between Cuba and Nigeria is built on this shared history and has grown stronger over the years through cooperation based on solidarity, mutual respect, and shared benefits. More than 400 Nigerian students have graduated from Cuban universities, mainly in medicine, health science, and other fields, becoming an important human bridge between our two countries. We have also worked together in areas such as public health, education, biotechnology, science, innovation, cultural, and sport. Both governments remain committed to expanding the cooperation. At an event dedicated to the Nigerian diaspora, Cuban paid tribute to all the men and women whose ancestors crossed the Atlantic under the most painful circumstances in the history, but who turned that the suffering into extraordinary cultural and spiritual heritage. Today, we celebrate not only the memory of our sharing ancestors, but also the present and the future of the strong friendship between Cuba and Nigeria. We are confident that our people will continue working together for a good, great justice, dignity, and cooperation. Allow me to conclude my recall the word of the historic leader of the Cuban Revolution, Fidel Castro, who once said, "Without Africa, the history of Cuba cannot be written." May this legacy continue to inspire us as we struggle the bonds of friendship between Cuba, Nigeria, and the entire African continent in this service of peace, cooperation, and the development in our nation. Thank you so much.
Thank you very much. Before I call the next speakers, we have to do some recognition. First, we have the Honorable Minister of State, Ministry of Foreign Affairs, Ambassador Shola Inikon-Laye, our very good friend, our supervising minister to the Commission. We also have with us distinguished Senator Anthony S. Yaro, Gombe South. He is also the Vice Chairman, Committee on Diaspora and NGO. Senator, you are welcome to 2026 National Diaspora Day celebrations. Next to speak with us, we have the European Union. Welcome him upstage. We are on NTA Live, the biggest and largest television network in Africa, the NTA. We're also live on Channels Television, and we are also live on TVC. So enjoy this wonderful package. Excellency, sir.
Your Excellency, the President of the Federal Republic of Nigeria, ably represented by Senator George Akume, the Secretary to the Governor of the Federation. Your Excellencies, ladies and gentlemen, allow me to stand on existing protocols. Dear members of the Nigerian diaspora, Nigerian explorers and conquerors from across the globe, peaceful conquerors, of course, but not less efficient for that. I feel very much identified with you because, finally, we diplomats, we are also members of diasporas of all countries. You know, I've spent most of my adult life myself out of my country as a diplomat. And so I would like to start by congratulating Honorable Dr. Abike Dabiri Erewa, the Chairman and CEO of the Nigerians in Diaspora Commission, for organizing the National Diaspora Day 2026. I would also like to commend you for launching the Diaspora Health Impact Initiative earlier this year and the Diaspora Health Week leading to today's celebrations. The European Union is pleased and honored to support NIDCOM in these initiatives, as well as the preparations for the National Diaspora Day 2026 through our support to migration governance project implemented by the International Organization for Migration, as its representative explained a few minutes ago. Regarding the theme of this National Diaspora Day, I would like to remind that the EU has been intensively supporting Nigeria's health system over the years. Our support has been guided by a shared commitment to universal health coverage, stronger primary health care, better health security, improved access to quality services, and resilient health local systems. When we speak about Nigeria's health system, we often focus on the challenges: persistent shortages in skilled health personnel, migration of trained professionals, pressure on hospitals from population growth, and the difficult reality of providing quality care for millions of people. But in fact, we should also look at a powerful opportunity: the immense expertise, experience, and commitment of Nigeria's global medical diaspora. Across Europe, North America, and other regions, there are thousands of Nigerian doctors, nurses, specialists, researchers, pharmacists, and health innovators carrying with them not only exceptional expertise, but also something even more powerful: a deep connection to their motherland, Nigeria. And that connection matters. Nigeria's global medical diaspora is not simply a story of talent that has left. It is also a story of talent that can still give back, still build, still teach, still mentor, and transform lives. The question is, how do we create the bridges that make contribution easier, deeper, and more lasting to become a strategic partnership for national development? This implies creating pathways for collaboration through telemedicine, specialist training, visiting faculty programs, curriculum development, research partnerships, mentorship, and investment in local health innovation. It also means building trust, strengthening institutions, and ensuring that those who want to contribute can do so in ways that are practical, transparent, and sustainable. Because the goal is not only to bring expertise home, the goal is to help build a health system where excellence can thrive at home. A health system where young professionals feel supported, where knowledge flows in both directions, where global experience strengthens local capacity, and where passions, families, and communities feel the real impact. The EU is well positioned to support the effective mobilization of diaspora medical expertise through 4 complementary channels: partnerships by linking Nigerian institutions with diaspora professionals, universities, and centers of excellence; funding by backing pilot programs innovation platforms, and blended finance opportunities that translate expertise into service delivery gains. Technical assistance by strengthening digital health, regulatory systems, public health institutes, and local manufacturing ecosystems. And finally, policy facilitation by supporting dialogue on accreditation, temporary return, research collaboration, and investment frameworks. In this way, diaspora engagement can become not only an expression of solidarity, but a structural contribution to stronger local health systems and national development. If we harness Nigeria's global medical diaspora with vision and purpose, we will not only respond to today's gaps, we will invest in tomorrow's resilience. And in doing so, we affirm a powerful truth that no matter how far people travel, their skills, their commitment, and their hope can still heal the nation they still very much feel rooted in or even call home. Thank you very much.
Thank you very much, Your Excellency. Thank you. We appreciate you. Distinguished ladies and gentlemen, we want to very respectfully request that for goodwill messages as much as possible, we'd like to keep to 2 minutes. As you heard earlier, we're live on television. We'll now take the next goodwill message from a very distinguished man par excellence, co-host of the Youth Summit tomorrow. That's Engineer Alfred Okoigun, who is Group Managing Director, ARCO Group. Please welcome him with a very distinguished diaspora round of applause. Sir, you're welcome, sir. And as he comes up stage for his goodwill message, we'll also be taking a little later Professor Fatima Kiari, as well as the Turkish ambassador and the honorable commissioners present. Please once again give Engineer Alfred Okoigun a round of applause. You're welcome, sir.
His Excellency, Senator Akume, representing the President of the Federal Republic of Nigeria, standing on the existing protocol. Truly, I wasn't expecting to speak on this forum because tomorrow is our day supporting the youth. And but then I'm here. Let me thank the organizers for this great job, for bringing our men and women from abroad in diaspora to participate in the nation building. I've listened to the panel discussion today, and I know the president, or the representative of the president wasn't here then, but I think it would be good that clip is played to the high-level cabinet of this nation, because these people who were in diaspora before they came to Nigeria to set up here, they made some very valid points, solid, for which I think we can borrow from. And what is coming out is we have started a journey, and coming together like this, we can also build our country to be emulated by other nations of the world. A foundation is being laid to bring that expertise that we see abroad to Nigeria. And there are so many examples that have been given. And all we just need to do is to latch onto them. And I think by what Nigerians are already doing all over the world, coming together now to form a formidable bloc and bring the youth into the fold and say, look, this is what is possible. And I think in the next few years, we'll be a great nation. We're already great, but we will be greater. So tomorrow, as I said, is our day, and I wouldn't want to take too much of the time. And I want to thank His Excellency and the federal government for sustaining this initiative, was to set a day aside for diaspora. It's a great thing already. And to continue to make sure we talk about it every year. All that will happen is we just be like we treat it like what has happened in other parts of the world. This is what China did at some point. South Koreans did it at some point in time. The hub of the technology of this, at least modern day today, we hear about in India, is as a result of this type of programs. So I'm really happy that we are doing the right thing. Thank you very much.
Thank you for that goodwill message, our lead sponsor. I'll have the honor and privilege to recognize Dr. Sunday Dare, Special Advisor to the President on Media and Public Affairs. Sir, you're welcome. Next, that will give us a brief goodwill message is Mr. Shehu Usman Usidi, the Managing Director and Chief Executive Officer, Federal Mortgage Bank of Nigeria, FMBN. Give him a round of applause as he walks upstairs.
The President of the Federal Republic of Nigeria, Asiwaju Bola Ahmed Tinubu, GCFR, ably represented by distinguished Senator George Akume, the Secretary to Government of the Federation, honorable ministers here present, members of the National Assembly, the DG NIDCOM, distinguished ladies and gentlemen. It is with great pleasure that I join distinguished guests, Nigerians in the diaspora, and all stakeholders gathered here today for the 2026 National Diaspora Day celebration. On behalf of the board, management, and staff of the Federal Mortgage Bank of Nigeria, I warmly congratulate the Nigerians in Diaspora Commission under the exemplary leadership of Honorable Dr. Abike Dabiri Erewa, OON, for organizing yet another successful National Diaspora Day celebration. This annual event remains an important platform for recognizing the immense contributions of Nigerians living abroad and for strengthening the enduring bonds between our compatriots in the diaspora and the homeland. Distinguished guests, the Federal Mortgage Bank of Nigeria recognizes that Nigerians in the diaspora remain a critical constituency in the nation's development journey. Through their expertise, investments, remittances, entrepreneurship, and unwavering commitment to Nigeria, our compatriots abroad continue to make significant contributions to the growth and prosperity of our country. At FMBN, we believe that one of the most meaningful ways to deepen the connection between Nigerians in the diaspora and their homeland is by providing them with a safe, transparent, and sustainable pathway to own homes and invest in Nigeria's housing sector. It is against this background that the Federal Mortgage Bank of Nigeria has been working diligently to introduce the FMBN Diaspora NHM Mortgage Loan, a landmark initiative designed to extend the benefits of affordable housing to eligible Nigerians living and working abroad. I am particularly delighted to recall that at previous engagements with the Nigerians in the diaspora community, including the National Diaspora Day celebration last year, the Federal Mortgage Bank of Nigeria expressed its readiness and commitment to launch this important initiative. Since then, we have continued to work with relevant stakeholders to ensure that the product is properly structured and positioned to respond to the unique needs and expectations of Nigerians in the diaspora. Today, I am pleased to announce that the long-awaited moment is now at hand. The Federal Mortgage Bank of Nigeria will officially launch the FMBN Diaspora NHM Mortgage Loan on Friday, 7th August 2026 in the United Kingdom. This launch represents a significant milestone in our collective efforts to deepen access to housing finance for Nigerians wherever they reside. It is also a fulfillment of the bank's commitment to providing a trusted and credible platform through which Nigerians abroad can confidently pursue their dream of owning a home in Nigeria. The FMBN Diaspora Mortgage Loan is a strategic intervention designed to strengthen the economic and emotional connection between Nigerians abroad and their homeland. It will provide an opportunity for eligible Nigerians in the diaspora to invest in home ownership build long-term wealth, plan for retirement in Nigeria, and contribute to national development. Beyond home ownership, we expect the initiative to stimulate housing construction, create employment, deepen mortgage penetration, promote greater formalization of housing transactions, strengthen confidence in the Nigerian mortgage system, and facilitate increased diaspora investment in the Nigerian economy. The initiative also reflects the bank's commitment to innovation and inclusion in housing finance. We recognize that the needs of Nigerians in the diaspora are unique, and our objective is to provide a mortgage financing framework that is secure, transparent, convenient, and responsive to the needs of Nigerians. The journey towards this milestone has been strengthened by the collaboration and support of key stakeholders, including the Federal Ministry of Housing and Urban Development, the Central Bank of Nigeria, the Nigerians in Diaspora Commission, international money transfer organizations, and other strategic partners. We deeply appreciate their contributions and remain committed to sustaining these partnerships as we commence the rollout of the Diaspora NHA mortgage loan. I wish to particularly acknowledge the invaluable support and partnership of NIDCOM under the able leadership of Honorable Dr. Abike Dabiri-Erewa. NIDCOM has remained a dependable partner in our efforts to deepen engagement with Nigerians in diaspora, facilitate stakeholder consultations, and promote initiatives that enable the diaspora to play an even greater role in national development. As I conclude this goodwill message, I invite Nigerians in the diaspora to look forward to the official launch of the FMBN Diaspora Mortgage Loan on 7th August in London. I encourage our brothers and sisters abroad to take advantage of this opportunity and join us in opening a new chapter in diaspora participation in Nigeria's economic development. Once again, I congratulate the organizers of the 2026 National Diaspora Day celebration and salute all Nigerians in the diaspora whose dedication, excellence, patriotism, and contributions have continued to bring honor and value to our dear country. Thank you very much.
Thank you very much.
At the top of your game.
Thank you. Thank you very much, sir. Thank you. Thank you very much. Just a few more recognitions as we proceed. Before we take the next goodwill message, I want to quickly recognize one of the foremost reporters on health matters in Nigeria, a name known with health reportage across the country. She's also a fellow of the Nigerian Institute of Public Relations. Chief Mrs. Moji Makonjola is here with us. Thank you very much, Ma, for joining us. We also recognize Ms. Amaka Obiokafo of the NIPR. Thank you very much for being here. We'll now take His Excellency Ambassador Mehmet Poroy, Turkish Ambassador to Nigeria, for a brief goodwill message. Your Excellency, you're welcome. Please welcome him with a round of applause.
Thank you. His Excellency, Mr. President of the Federal Republic of Nigeria, Bola Ahmed Tinubu, GSFR, represented here by Honorable Senator Dr. George Akume, Secretary to the Government of the Federation, Honorable Abike Dabiri-Erewa, Chairman of the Nigerians in Diaspora Commission, Honorable Ministers, distinguished guests. I am thankful for this opportunity, first of all, and I congratulate National Diaspora Day 2026. I commend also the Chairman of the Nigerians in Diaspora Commission for organizing this meaningful event. Nigeria has a large population and accordingly has a large diaspora all over the world. My country, Turkey, also, although not as much as populated Nigeria, has a large diaspora all around the world, mainly in Europe and America. We believe that diasporas have similar problems and opportunities as well. From this perspective, Turkey and Nigeria have started a fruitful cooperation through their relevant institutions. During the presidential visit to Turkey at the beginning of this year, a memorandum of understanding has been signed to further this fruitful cooperation. We will continue to work closely to exchange information, to exchange experience,
to the benefits of our diasporas all over the world. We are thankful to the chairman of Nigerians in Diaspora Commissions for her efficient contributions to this end. I thank you again for this opportunity, and I wish you a very successful event. Thank you very much.
Thank you very much, Ambassador Mehmet Porov, Turkish Ambassador. We also have with us Honorable Dr. Tijani Aliyu Ahmed, Honorable Federal Commissioner and Chief Executive, National Commission for Refugees, Migrants, and Internally Displaced Persons. Sir, you're welcome. Can we have you for your message? Give him a round of applause as he takes the stage.
From the roots we rise.
Your Excellency, the President of the Federal Republic of Nigeria, ably represented by His Excellency, the Secretary of State Government, Dr. George Akume, all ministers here present, my sister, the CEO, Diaspora Commission, distinguished ladies and gentlemen, I am honored to deliver this goodwill message at the 2026 National Diaspora Day celebration, a significant occasion that continues to celebrate the invaluable contributions of Nigerians in diaspora to our nation's growth, development, and global standing. I extend my deepest appreciation to our sister agency, NIDCOM, under the visionary leadership of Dr. Abike Dabiri Erewa, OON, for consistently building bridges across oceans. With tenacious effort in promoting the interests of Nigeria in diaspora and strengthening their connection with the homeland through strategic engagement, advocacy, and innovative programs, has continued to position the Nigerian diaspora as a vital development partner and an indispensable national asset. I wish to express our profound appreciation to His Excellency, President Bola Ahmed Tinubu, GCFR, Commander-in-Chief of the Armed Forces of the Federal Republic of Nigeria, for unwavering commitment in strengthening migration governance and deepening diaspora engagement as critical pillars of Nigeria's development strategy. Under the renewed hope agenda, the federal government has continued to pursue reforms and initiatives that recognize migration as a catalyst for economic growth, human capital development, international cooperation, and national security. The President's sustained support for institutions responsible for migration governance has enabled Nigeria to consolidate in leadership on migration issues at the regional and global levels. Our country's continued implementation of the Global Compact for Safe, Orderly and Regular Migration, GCM, strengthened interagency coordination, and sustained engagement with the regional and international migration frameworks underscored Nigeria's determination to promote well-managed migration for sustainable development. We remain committed to translating these achievements into tangible benefits for all Nigerians, both at home and diaspora. This year's theme, harnessing global diaspora medical expertise to strengthen local health system for national development, speaks directly to what it is at stake. The mandate of NIRCOM and NCFRMI are two sides of the same coin. We represent the complete continuum of Nigerian mobility and must continue to complement each other. NIRCOM manages the diaspora, those who have found success, wealth, and expertise abroad. NCFRMI manages migrants, refugees, and the displaced persons, those navigating the vulnerabilities of movement, as well as returnees who require structured reintegration. Working in silos
is an expensive inefficiency we cannot afford. The synergy between our two commissions is a developmental necessity in multiple ways. When medical professionals choose to return home permanently or via short-term rotations, NCFRMI migration management frameworks will ensure their seamless, bureaucratic-free entry and local resettlement. Through our partnership, the clinical actions launched under NIDCOM Diaspora Health Impact Initiative, DHI 2026, can directly target NCFRMI resettlement cities and IDP camps. The specialist services provided by our diaspora can reach those who cannot afford basic medication. Together, we can mark the exact skills of Nigerians abroad and match them diligently with the humanitarian, diagnostic, and clinical gaps on the ground. Distinguished ladies and gentlemen, the brain drain we have lamented for generations is ready to become our greatest brain drain. If we embark on the faithful implementation of decisions that must happen here today, the doctors, nurses, and pharmacists we lost in the West have now forgotten home. They are simply waiting for a system that is structured, predictable, and strategic. Let this National Diaspora Day be the line in the sand. Let us stop wishing for a resilient home and abroad. NCFRMI stands ready to work side by side with NIDCOM to make this happen, turning migration into opportunity and expertise into impact. Together, let us continue to harness the immense potential of Nigerians across the globe in building a more prosperous, resilient, and globally competitive nation. I thank you all.
Thank you very much. We appreciate you, sir. We'll take a few more and we'll be done in a bit. I'd like to list that will be taken in this order. We'll take the representative of the Controller General of Immigration. Afterwards, we'll take Professor Usman Malami Aliyu, Director General, CEO, National Institute of Cancer. Then we'll take the Registrar of the Medical and Dental Association and end with the International Center for Migration Policy Development. We now move on to invite, respectfully, the ACG S.O. Funshaw, ACG Medical Services Nigerian Immigration Service, representing the Controller General Immigration. Sir, we will plead that you keep to the 2 minutes. Thank you.
South Africa, Botswana, Namibia, Kenya, Tanzania, Uganda, Ethiopia, Rwanda.
His Excellency, the President and Commander-in-Chief of the Armed Forces of the Federal Republic of Nigeria, Asiwaju Bola Ahmed Tinubu, GCFR, ably represented by the Secretary to the Government of the Federation, Senator Dr. George Akume, CON. Please permit me to rest on the already established protocols in view of time. I'm here representing the Controller General of Nigeria Immigration Service, KN Nandab, to give a goodwill message. It is my pleasure to join distinguished guests, members of the diplomatic community, our esteemed Nigerians in the diaspora and other stakeholders at the 2026 National Diaspora Day celebration. I commend Nigerians in Diaspora Commission for their unwavering commitment to strengthening the bond between Nigeria and its citizens abroad. The contributions of Nigerians in the diaspora remain invaluable to our national development. Notably, Nigeria has maintained its position as the largest recipient of diaspora remittances in sub-Saharan Africa for over 20 years, accounting for more than 1/3 of the region's remittance inflows, with annual receipts exceeding $20 billion in recent years. With these inflows, vital foreign exchange, supporting millions of households, stimulating investments, and contributing significantly to the country's national economic development and security. The theme of this year's celebration harnessing global diaspora medical expertise to strengthen local health systems for national development is both timely and strategic. It underscores the importance of leveraging the knowledge, experience, and innovation of Nigerian medical professionals across the globe to strengthen healthcare delivery, promote capacity building, and improve health outcomes for our people. As the agency responsible for migration management and issuance of travel documents, the Nigeria Immigration Service remains committed to facilitating safe, legal, and orderly migration while providing efficient, technology-driven immigration services. In furtherance of this commitment, the service has implemented several reforms, including the contactless passport application system, the Nigeria Visa Policy 2025, the introduction of the F9A and F9B visa categories for Nigerians by birth and descent holding foreign passports, and the medical tourism visa F7C, which facilitates the entry of foreign nationals seeking specialized medical treatment in Nigeria, thereby supporting the country's growing healthcare sector and overall wellness aspirations. Beyond migration management, the service recognizes the diaspora as an indispensable partner in nation building through investments, skills transfer, innovation, entrepreneurship, humanitarian interventions, and advocacy. Nigerians abroad continue to make impactful contributions to national growth. The Nigeria Immigration Service will continue to implement policies and initiatives that promote seamless engagement between Nigeria and its global citizens. On behalf of the officers and men of the Nigeria Immigration Service, I congratulate Nigerians in Diaspora Commission on another successful National Diaspora Day celebration and reaffirm the service's commitment to supporting initiatives that strengthen relations with Nigeria in the diaspora. Thank you, and God bless the Federal Republic of Nigeria.
Another good round of applause for Immigration CG, here represented by the Assistant Comptroller General. Next to make a goodwill message is Professor Usman Malami Aliu, Director General and Chief Executive Officer, National Institute for Cancer Research and Treatment. Give him a round of applause as he talks to us.
President of the Federal Republic of Nigeria, His Excellency Asiwaju Ahmed Bola Tinubu, ably represented by our father and the SGF of the Federal Republic of Nigeria, Senator George Akume, my able Minister of Health, Dr. Isiaq Adekunle Salako, the DG CEO of NIDCOM Commission, distinguished CEOs, invited guests, ladies and gentlemen. It is a great honor to join distinguished government officials, members of the diplomatic corps, development partners, healthcare professionals, our esteemed diaspora community, and fellow Nigerians gathered here today to commemorate the National Diaspora Day 2026. I commend Honorable Abike Dabiri Erewa, the Chairman CEO of the Nigeria in Diaspora Commission, NIDCOM, and the entire NIDCOM team for providing this important platform to celebrate the invaluable contributions of Nigerians living abroad and to strengthen partnership that advance our nation's development. The theme of this year's event, harnessing global diaspora medical expertise to strengthen local health system for national development, is both timely and inspiring. Across the world, Nigerian healthcare professionals continue to excel as clinicians, researchers, educators, innovators, and health leaders. Their expertise is one of our nation's greatest assets. And by connecting this global talent with our local health priorities, we can significantly strengthen Nigeria's health system. At the National Institute for Cancer Research and Treatment, NICRAT, we believe the collaboration is essential for reducing Nigeria's growing cancer burden. We have made important progress through the implementation of National Cancer Control Plan, strengthening cancer research, expanding cancer registries, improving work capacity, and promoting early detection and timely referral. Yet, there is still much to accomplish. We therefore invite the Nigerian health professional in the diaspora to partner NICRAT through research collaborations, specialist training, membership, technology transfer, clinical exchange, innovation, and investment. Your knowledge, expertise, and network can help transform cancer prevention, diagnosis, treatment, and research in Nigeria. One area where partnership is essentially critical is sustainable financing. For many Nigerians, the cost of cancer care remains beyond reach. Through the National Cancer Health Fund, NICRAT is working to reduce financial barriers and improve access to life-saving diagnosis and treatment for the vulnerable patient. Today, I warmly invite our diaspora community, philanthropic organizations, development partners, and the private sector to support the expansion of Cancer Health Fund, whether through financial contribution, technical expertise, or strategic partnership. Your support will help save lives and ensure that no Nigerian is denied cancer care because of the hardship. Before I conclude, I wish to express my sincere appreciation to the Honorable Coordinating Minister for Health and Social Welfare, Prof. Muhammad Ali Pate, CON, and the Honorable Minister of State for Health and Social Welfare, Dr. Isiaq Adeokulle Salako, for their visionary leadership and unwavering support toward the expansion of cancer prevention, diagnosis, treatment, and research care across the country. I also wish to express our profound gratitude to His Excellency, President Bola Ahmed Tinubu, GCFR, whose renewed health agenda continues to drive transformative reforms across Nigerian health sector, creating an enabling environment for strengthening cancer care and improving health outcomes for all Nigerians. Thank you once again for your commitment to our nation. I look forward to building stronger partnership for a healthier nation. Thank you and God bless.
Thank you very much, sir. Would need to request humbly that those coming for goodwill messages keep to the 2 minutes. We're inviting now for goodwill message Registrar, Medical and Dental Council of Nigeria, Professor Fatima Kyari, will be speaking in 2 minutes. Prof, if you're here, please welcome her with a round of applause. Usually, medical people don't talk too much. They're either in the theater or taking care of patients. So I'm sure Prof will do this in 2 minutes. Prof, thank you.
His Excellency, the President of the Federal Republic of Nigeria, President Bola Ahmed Tinubu, ably represented by Secretary to the Government of Federation of Nigeria, Senator George Akume. The Honorable Minister of State for Health, Dr. Isiaq Salako, other ministers here present, members of the National Assembly, my sister, the DG of NITCOM, Honorable Abike Dabiri. Distinguished ladies and gentlemen, all protocols observed. Good afternoon. It's with great pleasure for me to attend this National Diaspora Day celebrations of 2026. It is a clear cooperation between the government and its diasporans and is yielding positive results. May I start by extending our warm congratulations to the Nigerians in diaspora and most especially the health community, and to the Nigerian government through the Nigerians in Diaspora Commission for paying tribute to the diaspora annually. I believe that the joint effort can make greater contributions to the nation at large to write a new and splendid chapter in the history of diaspora government collaborations. This year's theme is particularly interesting to us. It says, harnessing global diaspora medical expertise to strengthening local health systems for national development. It is quite apt, it is timely. The Nigeria Health Sector Renewal Investment Initiative, which has been put forward by the Federal Ministry of Health, led by the Honorable Coordinating Minister of Health and Social Welfare, Professor Muhammad Ali Pate, is designed to give Nigerians a renewed hope within and provided by the professions of medicine and dental practice. And we have the right team at the Ministry of Health to propagate that. The Medical and Dental Council of Nigeria is the medical regulatory authority, and it aligns with the Health Sector Renewal Investment Initiative. Over the years, we have enabled Nigerian doctors and dentists that work outside Nigeria to be able to update their licensure and to be part of the Nigerian healthcare workforce ecosystem. And in the past several months, we have given them the confidence and also the ability to be able to come back home and provide their services at home. Your Excellency, at the Medical and Dental Council of Nigeria, we have developed an expansion of medical education so that we get more doctors trained in Nigeria. And in all the different aspects, we plug in to Nigerians in the diaspora. In the simulation-based development of simulation-based training, we have them on our committee. In the review of Code of Medical Ethics, we have them on the committee. And most especially, we developed a program called SCALE, the strengthening of collaborations and advancing clinical excellence. And this we have done with Nigerian doctors in Great Britain. And we have tried to align the different colleges of medicine, the Royal College of, the different Royal Colleges of Medicine in the UK, and the different faculties of medicine in the National Postgraduate Medical College. Let me therefore appreciate and celebrate all Nigerians in the diaspora on this very auspicious occasion, and also congratulate NITCOM for the various efforts put in place in organizing this annual event, and especially involving the healthcare workforce, including the Nigerian Medical Association and all the healthcare workers in Nigeria. I thank you, Honorable Dr. Abike Dabiri. Thank you, and God bless the Federal Republic of Nigeria.
Thank you very much. Please give her another round of applause. As I will now very quickly invite the president of the Nigerian Medical Association, NMA, Professor Afekide Ernest Omoti, to please come up for his goodwill message in 2 minutes. Please welcome Prof with a round of applause, sufficient enough to ensure he keeps to 2 minutes. Prof, thank you.
The President of the Federal Republic of Nigeria, ably represented by the Secretary of State Government, Secretary of Government of the Federation, the Honorable Minister of State for Health and other ministers here present, the Chairman of NICOM, Honorable the Director General of NICOM, Honorable Abike Dabiri. Let me stand on the existing protocol because of time. On behalf of the leadership and entire membership of the Nigerian Medical Association, I'm honored to deliver this goodwill message at the 2026 National Diaspora Day celebration. At the outset, I wish to commend the Nigerians in Diaspora Commission, its visionary leadership in fostering meaningful engagement between Nigeria and our citizens across the globe. The theme of this year's celebration, harnessing global diaspora medical expertise to strengthen local health systems for national development, is both timely and strategic. It resonates strongly with our nation's ongoing pursuit of universal health coverage, improved health outcomes, and sustainable national development. Today, we celebrate not only the remarkable achievements of Nigerians living abroad, but also their enduring commitment to the progress of our country. Across continents, Nigerian medical professionals have distinguished themselves as clinicians, researchers, educators, innovators, public health experts, and healthcare administrators. Their contributions to global healthcare continue to earn respect for our nation and exemplify the exceptional capacity of the Nigerian talent. The Nigerian Medical Association recognizes that our health sector stands at a critical juncture. While notable progress has been recorded by this administration, significant challenges still persist in several areas. Addressing these challenges requires collective action by those at home and abroad, innovative thinking, and strategic partnership. The Nigerian medical diaspora represents a vital national asset. Beyond remittances, they bring vast knowledge, advanced skills, global networks, research capabilities, and exposure to best practices that can accelerate healthcare transformation in Nigeria. We therefore advocate for the establishment of structured and sustainable platforms to facilitate diaspora engagements. The Nigerian Medical Association firmly believes that diaspora engagement should not be perceived merely as brain drain. Rather, it should be embraced as an opportunity for brain gain and brain circulation. With deliberate policies and enabling environments, the expertise required by our professionals abroad can be effectively harnessed to strengthen local health systems while fostering mutual professional growth. As the umbrella body of medical professionals in Nigeria, the NMA remains committed to collaborating with NICOM, government institutions, healthcare stakeholders, development partners, and diaspora organizations. Together, we can create pathways that encourage meaningful contributions from Nigerian professionals abroad. As we celebrate this year's National Diaspora Day, let us reaffirm our collective resolve to build bridges across Nigeria, strengthen professional collaborations, and harness immense potential of Nigerians everywhere for the benefit of our people. Long live the Federal Republic of Nigeria. God bless you.
Thank you very much. And now, Your Excellencies, distinguished ladies and gentlemen. Before we take the next one, I'll invite my senior colleague to invite the last goodwill message, and then afterwards we'll welcome the chairman CEO of NIDCAM, Gabriel Odum.
Okay, we are running against time, so I'm making it swift and fast. We invite ICMPD Isabel Wolfs-Gruber, Head of Office Nigeria, Senior Project Manager, FMM2, Pan-African Region. Welcome and give us your brave goodwill message. Thank you, our partner.
Good evening. Allow me to stand on existing protocol also in light of time. Thank you very much for having us today. On behalf of the International Center for Migration Policy Development, I would specifically like to thank Dr. Bike Rabire for all the work that you do in terms of advocacy and strengthening the relationships between Nigerians and the diaspora. This year's theme could not be more relevant. Over the next 2 days, this gathering will do justice to the technical discussions that medical professionals in this room are far better placed to do. Rather than duplicate those discussions, I would like to reflect on a broader idea that sits at the heart of this theme. What I want to draw attention to instead is the underlying idea that theme rests on, that the knowledge, skills, and expertise Nigerians build outside the country are not lost in Nigeria. They're rather one of the country's most under-recognized assets, one that can, with the right platforms, return home in useful form. That principle stretches well beyond medicine. Over the past year, ICMPD, through the EU Diaspora Facility, has been proud to work with the Ministry of Tourism, Arts and Culture and the National Commission for Museums and Monuments on a project that applied the same logic to a very different sector, Nigeria's cultural heritage. The work, based in Lagos, brought together federal, state, local, and international partners, and specifically Nigerians in diaspora, to strengthen the institutions that hold and pass on this country's heritage. 55 custodians were trained in heritage preservation. More than 50 traditional artifacts were digitally documented. These may appear to be modest numbers, but each one represents strong institutions, preserved knowledge, and a foundation for future generations. The connection to today's theme is a simple one. Whether the expertise is medical or curatorial, whether it sits in a technical hospital in Canada or in a museum in Germany, the same principle applies. Nigeria's diaspora holds knowledge that Nigerian institutions can learn from and grow with. The challenge before us is not whether expertise exists, it clearly does. The challenge is creating the partnerships, policies, and platforms that allow us to expertise to circulate. ICMD remains committed to supporting mobility schemes, knowledge exchanges, and institutional partnerships that connect Nigerians at home with Nigerians abroad. Together with NIDCAM and other partners, we look forward to deepening these efforts in the year ahead. I congratulate NIDCAM in convening this platform and wish us all fruitful deliberations. Thank you very much.
Thank you very much. And now we make way for Oriofe Sachs to bring up Honorable Dr. Abike Dabirerewa, Officer of the Order of the Niger. She is the Chairman CEO of NIDCAM, ever hardworking, ever loving the diaspora, ever doing what she needs to do. Please give her a round of applause as she makes her way to the stage, guarded by the talented young Oriofe Sachs. And she's growing and doing well. Please, another round of applause.
And she always performs since she was 5. I saw her today. I said, you've grown taller. Nice to see you. Amazing talent. Thank you, Ori Ofesax. Any event, please call Ori Ofesax. Thank you very much. Wow, what a day. 2026 Diaspora Day. Can we just appreciate that we're all in this room? Your Excellency, Mr. President, ably represented by the SGF, Senator George Akume, thank you very much. Chairman, Senate Committee on Diaspora, represented by Senator Yaro, our favorite senator, thank you for being here again. My brother, Chairman, House Committee on Diaspora, Honorable Tochukwu Okere, my darling friend, thank you again for being here today. Honorable ministers here present, our Minister of State Foreign Affairs, Ambassador Enikon Laye Mo. I just got the Ambassador Enikon, Ambassador Shola Enikon, a friend and brother. Thank you so much for all the support you're giving the Commission. And of course, our Minister of State, Health, our brother, Dr. Salako. Thank you very much, Doctor, for this collaboration. Let me pay my respect and compliments to all our partners. Ambassador of Turkey, thank you very much. He's all been with us. Ambassador of EU Ambassador, thank you very much. My sister from Cuba, thank you. ICPMD, you're always there for us. IOM, thank you for your support. You play so much role in this year's event. ARCO, thank you very much. Dr. Ali Garba, sitting quietly there, thank you very much. NMA, you're welcome. Refugee Commission, our partner, thank you very much. Cancer Center, Dr. Kiari, our sister, King's College Hospital. The diaspora doctors are building another center of excellence, so be ready for competition. Dr. Kiari, sorry, let me just greet everybody and say welcome. And of course, Dr. Menakaya, the lead of the DHII, President Mansak, and all the diaspora groups in the room, good evening or good afternoon. Really, it's a pleasure to have you in this room today. We were with the president who met all the diaspora leads just this afternoon, and it was a beautiful meeting. Can we start by appreciating President Bola Ahmed Tinubu for all he's been doing with the Renewed Hope agenda? So we welcome all our diaspora from all the regions of the world in this room. Not just healthcare practitioners, we have professionals in this room. I can see them from everywhere in the room. I can see even the creative industry. Chike came all the way from San Jose, California. I can see you. Ramsey Noah, I saw you somewhere there. Where are you? Where? Okay. I hope you are not going to diaspora. You are here because you are speaking tomorrow. So thank you very much. Really, let me just say that our mandate as DISCOM was clear. Engage, empower, and enable Nigerians in the diaspora. So today in 2026, we can say with pride, we have moved from policy to impact. For the first time, Nigerian diaspora, you all have a voice at the highest level of government. President Buhari, when he made me chairman, used to meet the diaspora. And President Bola Ahmed Tinubu has taken that even higher, engages the diaspora anywhere he goes. And today, like I said, he met our diaspora healthcare practitioners at the Aso Rock Villa. And we thank Mr. President for that. Thank you. So the diaspora has been institutionalized in Nigeria through the Federal Executive Council that approved the National Diaspora Policy 2021. It guides all MDAs on diaspora matters. And what have we done? Part of it is to have diaspora focal persons in every state of the Federation. They're in the room. Diaspora focal persons, can we see you? Yes, thank you. So if you have any problem in the states, go to them. We have 36 of them in every state of Nigeria, engaging with their diaspora from every state of Nigeria. We're working on the database for a national diaspora database. There will be a QR code that will be shared to everybody. Please, if you have not registered, register on the diaspora database. And we're partnering with NIMSI, the National Identity Management Commission, to enhance the database. Now, let's look at health and education. This is where what we call the Diaspora Health Impact Initiative partnering with the Ministry of Health and NMA and NITCOM, truly shines. I'm so proud of our medical practitioners that have been home. For how many weeks now? You're going to hear more about what they have done. Thank you so much. And this is where that partnership shines. Medical missions, telemedicine, and diaspora health investments in over 20 states in Nigeria. Our medical practitioners and nurses are now doing remote surgeries and training Nigerian healthcare personnel. Now, this year, the first DHII 2026 took a zonal approach. They've gone to the 6 zones of Nigeria. Campard, where are you? All the way from Canada. They took on FCT and parts of Nasarawa. From Northwest, Kano, Kaduna, and Sokoto, Mansag went there. You'll hear more about that. Northeast, they went to Borno, Concerned Medics Foundation. Please clap for them as I read out their names. In the Southeast, they went to Imo, Abia, and Enugu, and that is ANPA, all the way from America. In the South-South, NAMDA, all the way from Australia, went to Edo, Delta, Rivers. He is not here with us yet because they were caught up. The team is not here with us yet because they were caught up in the Enugu air incident in Benin. So they'll be flying in a bit later. We want to thank NMA, my sister, Dr. Kiari, and the Ministry of Health for their amazing collaboration. Our diaspora Medicare groups and individuals have equipped hospitals, PHCs, and trained medical and donated medical equipment worth billions of naira. We do celebrate you anywhere you are in the world. Now let's look at education. The Ministry of Education has introduced what we call the Diaspora Bridge, and is bringing over hundreds of academics home during their sabbaticals, and they also train people virtually. I just got back from the Silicon Valley, where we are collaborating with institutions there, particularly the San Jose University, to train young Nigerians. We call it the Silicon Valley Tech Bridge. In fact, the governor of Anambra State is already keyed into it. He wants to build a Silicon Valley in Anambra, and is going to be working with the Nigerians in the diaspora. So please, we'll be collaborating in this area. Let's look at investment, remittances, and economic linkages. From $17 billion in 2019 to over $21 billion in 2025, all from you, the diaspora. So we started the Diaspora Investment Summit to encourage you to invest at home, and I'm proud to say that in the fields of agriculture, health, education, real estate, agriculture, the diaspora are investing back home, and we celebrate you. Now, this year, we're going to have the Nigeria-Saudi Investment and Tourism Summit, August 4th, here in Abuja, put together by a group of Nigerians in Saudi Arabia partnering with us. Then in Canada, Toronto, August 11 to 15, we're having the first Nigeria Diaspora Economic Conference working with Nigerians in Canada. That, again, I believe, will promote growth in our country, Nigeria. Then diaspora mortgage and housing, we heard the MD of FMBN. We're starting the diaspora mortgage scheme August 7th in the UK. It's going to go all over the world. What it means is that you can get a 100 million mortgage, you pay for 6 months, we know that you earn a salary, and then you can get the 100 million mortgage. Is that not a good thing for the renewed up agenda of Mr. President? Encouraging you, the diaspora, to own your own homes. Can we appreciate Federal Mortgage Bank and the partnership we have with you? Now, let's look at advocacy and humanitarian impact. During COVID-19, the diaspora got together and donated equipment worth billions of naira to support fellow Nigerians. Thank you very much for all you do. And we at NITCOM, we have coordinated along with other stakeholders to ensure safe return of Nigerians from countries like Sudan, Ukraine, Libya, Lebanon, Saudi Arabia, UAE, India, Egypt, Turkey, China, Malaysia, Thailand, Oman, Mali, Ghana, Kenya, and of course, recently, South Africa. And I want to thank Mr. President, who made it possible to bring Nigerians back home. Immediately he said, get them back home. And I thank the Ministry of Foreign Affairs, our ambassador is here, who made sure there was a seamless coordination with our embassy in South Africa and, of course, other agencies. Now, that South Africa thing is pathetic, really. And Nigeria, we should not look the other way. We must demand compensation for Nigerians who have been roughly treated and who had to leave everything. They have jobs. They left everything they ever owned, and they're back home. But they're back home, and I know that their lives will be better as they're back in Nigeria. Tomorrow, we'll be meeting 2 of them. Now, our legal department, Ife, where are you? We have a woman who heads our legal department now. They've treated over 1,200 cases of detention and mistreatment of Nigerians abroad, working with the consular department in the Ministry of Foreign Affairs. And we do get a lot of them resolved. And then media, communication is everything. We want to thank NTA, TVC, and Channels Television, and Ben TV UK. They now have permanent programs on the diaspora, celebrating the diaspora anywhere in the world. And they never lack content, but there's so much to celebrate about you, our diaspora. And then let's talk about trafficking and rescue support. We work with NAPTIP in that regard. And just yesterday, I don't know whether he's in the room, Professor Jude, are you here? Professor Jude, are you here? We just brought back a girl from Cairo, working with him. Is a member of NIDO Africa, working with Professor Jude. A young girl just got back yesterday, trafficked, helpless, homeless, but she's back home with her parents in Port Harcourt. That is working with the diaspora. The same thing with Ghana, Dr. Callistos. If the cases have gone down, it's what NIDO Ghana worked with us and NAPTIP to say, listen, we have to stop this. So thank you, diaspora, for all the work you do. Thank you very much. And I know that we have to talk about diaspora voting, which is where I look at Honorable and my dear Senate brother. We are hoping that you will consider diaspora voting. I know it's not going to happen in 2027 because it's not in the Constitution and our amendment, but it has to happen someday. So please hold National Assembly responsible for diaspora voting because they are going to ask you. And then culture, identity, and global image. We will be coming up with an initiative to identify extraordinary and exemplary Nigerians. We call it the Diaspora. What name did we give it? Anyway, we're going to have diaspora champions all over the world. All of you are already champions. Wherever you are, we see that you're doing very well. You're celebrating Nigeria. We make you a diaspora champion in every part of the world. We thank you all. And tomorrow, the National Diaspora Merit Award, the 4th one that we're hosting. I congratulate all the awardees, the past, and those that will be getting the awards tomorrow. We celebrate you because you're excelling not just abroad, but also excelling back home. Then we have the youth. We can't ignore the youth. And we have the NIDCOM Youth Empowerment Summit tomorrow, hosted by Mr. Alfred Okoegun. And Bobby Diggy, all the way from New York, is also a sponsor of that category. It's a beautiful event where we mentor and get together young Nigerians by the diaspora. We have Mr. Anosike here, all the way from America and China. He'll be there again tomorrow. A great basketball player, all the way, one of the best in the world. You're welcome. Stand up, let them see you. Our basketballer. Then partnerships. We partner with MDAs, international organizations, to carry out this mandate. Of course, number one is the Ministry of Foreign Affairs, our parent partner. IOM, thank you very much. ICMPD, thank you very much. Refugee Commission, our partners. NIMSI, Immigration Service, you've made our jobs easier with the contactless passport. We don't get those complaints anymore. So we all have worked together to promote our country, Nigeria. So I want to thank, again, Professor Pate. He's not in the country now. He couldn't be here. But, of course, we have Professor Dr. Salako here with us. Thank Honorable Minister of State Foreign Affairs. Thank you very much. And I want to thank especially the Minister of FCT, who supported this program absolutely. He's not around at the moment, but he made it possible for us all to be aware. Wike is working. I'm sure you've all seen it. If you drive out Abuja, you see that Wike is working. Thank you, Minister Wike, for the tremendous support you've given this program this year. NMA, thank you very much. Medical and Dental Council of Nigeria, and all the DHIR leads. Can we all see the DHIR leads? UK, Mansag, let's see you. AMPA, let's celebrate you. Germany. Germany, look at Germany there with this Zagbada that the president appreciated today. Australia is not here. Like I said, is talking Benin. All the way from South Africa, Dr. Akombi. Concerned Medics Foundation, where are you? Thank you very much. They led, am I missing out anybody? I think that's, Canada, Campard, where are you? Thank you very much. They came from all over the world to give back to the society. They've done life-breaking surgeries. In fact, when you hear what they've done, you'll be so impressed. Thank you so much. We appreciate you. Coming up on their own, buying their tickets, and ensuring that they change healthcare delivery in Nigeria. Thank you so much. We appreciate, just as the president appreciated you this afternoon. Thank you very much. All our resource persons, I thank you very much. If you think the first session today was fantastic, and we appreciate them. We thank you. That was real. And like Mr. Okoigun said, we need to play that tape again to the highest authorities. It's something that everybody must listen to. Thank you very much to all of you. Dr. Erogbe, Dr. Timileyin Olusheye. Dr. Olusheye has won all the awards in his institution. He's home here today. Where are you, Dr. Timi? Another amazing medical practitioner. Thank you. Dr. Aisha Umar, Dr. Benjamin Ayaun, Dr. Biodu Ogumbo, Dr. Ibrahim Wada, Dr. Emilia Iwu, Professor Okoye, Professor Abali, and then the nurses are here, Dr. Iwu and Wendy Olayinka, nurses in the UK. Where are you? Thank you very much. So the nurses are also with us. The pharmacists are quarreling with me, but they'll be part of everything we do. Thank you very much. Dr. David Ikuda-Isi was also on the panel. Thank you very much. It was an amazing session. And let me thank all our partners. FCTA, thank you. Sarah is here, the FCT focal person. Thank you very much. ARCO Group, thank you for making this possible. First Bank, our partners for a long time. O3 Capital, First Tricon Limited, Green Pasture Homes, Providence Unity Bank, Cersei Intelligence, another young guy building data. You have to listen to him tomorrow. IOM EU, thank you so much. Linkage Assurance PLC, Omega City and Properties Nigeria Limited, Mobi Health, also doing great things in health, Pivot Integrated Energy Services Limited, Stanbic IPTC Pension Managers. They want to start doing pension for diaspora. I think you should listen to them. Access and Pensions too. Canvas Institute, that's Bobby Diggy, who has been supporting us from the word go. UBA, United Bank for Africa, and the American University of Nigeria. We thank all of you, and we thank all diaspora groups. Nigeria Diaspora Organization, are you in the room? Yeah. Thank you very much. But Naidu, you have to be one united Naidu. Let's leave differences aside. Let's solve whatever it is. Today, our doctors went to see the president because they are united. So please, let's work as one united Nigeria Diaspora Organization in all parts of the world. I thank all of you too and all diaspora groups all over the world. So looking ahead, as we prepare for the next phase, the focus of the commission include the following: to have a diaspora investment fund. We're waiting for FEC to pass that, and I believe it will happen. Then the Diaspora Health Initiative is not going to be a one-off thing. Together, I know we can bring together 1,000 healthcare professionals who can be engaged annually. I'm sure all organizations that are here can do that. And the National Assembly, diaspora, voting. Are you nodding? So, ladies and gentlemen, let me thank Engineer Dr. Sule Yakubu Basi. Dr. Basi, can you come up? The Secretary of the Commission, the LOC Chairman, and all of the organizing commission. All of you, come up. Please, let's have everybody in this Ankara. Please come up. Can you appreciate these hardworking men and women? Akombi, LOC Chairman, Mahmoud, Gabriel Oju, our cameraman. You two leave your camera and come. Rosemary, Mahmoud, Akin, Funke, Elion, Boyiga, our immigration rep, Balogun, all of you, please come, some of you come on this side. Eziaka, some of you come on this side. Please let me appreciate these hardworking men and women. I know I stressed them in the last few days, but here we are today. Thank you very much for all the hard work. And we thank Mr. President, President Bola Ahmed Tinubu, for believing that Nigeria's greatest asset are our people, both at home and abroad. When we were established in 2019, and I was made the pioneer chairman, many people asked, what can the diaspora do for Nigeria? Today, the answer is obvious. A whole lot of things the diaspora can do for Nigeria and are doing for Nigeria. I'm happy to say that 12 countries have visited NIDCOM to understudy how we're engaging our diaspora. The diaspora are no longer just about remittances. You are building hospitals, conducting medical missions, lecturing in our universities, investing back home in agriculture, SMEs, IT, digital infrastructure, and most importantly, you are defending Nigeria's image abroad globally. Let's clap for our diaspora again. You are truly our ambassadors at large. We have a few bad eggs, but we have, give me one bad story, I'll give you 1,000 good stories about Nigeria and Nigerians abroad. You are our 7th region. And we as a commission, we have moved from promise to performance because we are one nation, one people. The journey continues, ladies and gentlemen, your excellencies, and the best is yet to come from and with our diaspora. Happy Diaspora Day 2026 as we look forward to a great event. Thank you very much. Thank you very much as we welcome our NSCDC boss, who has been supporting us. So thank you very much. One nation, one people, one Nigeria. Nigerians at home, we work with Nigerians in the diaspora, and we'll build the greatest country in the world under the leadership of President Bola Ahmed Tinubu, whose renewed up agenda has made it possible for all of you to be here today. Thank you very much, and God bless you. God bless Nigeria, and take us to the highest high. Thank you very much. Thank you. Thank you. Thank you. So I'll go ahead. So I'll just go ahead and let's thank Faith, our interpreter. So I'll go ahead and just respectfully invite my minister, our minister, the Honorable Minister of Foreign Affairs, State, Ambassador Shola Enikonlaye. Thank you very much, sir. Please clap for him and welcome him to the get here.
Welcome Ambassador Shola Enikonlaye, Honorable Minister of State, Ministry of Foreign Affairs. Your Excellency.
Thank you very much, the Masters of Ceremonies, President Bola Ahmed Tinubu, GCFR, ably represented by my brother, distinguished Senator Dr. George Akume, CON, the Chair and Chief Executive of NIDCOM, Honorable Abike Dabiri-Erewa, distinguished ministers here present, Chair of the Standing Committee on Diaspora, as well as the Chair of House Committee on Diaspora, other senior government officials present here this evening, Excellencies, Ambassadors, High Commissioners, the Secretary of NIDCOM, my dear friend, Dr. Sule Yakubu Basi, leadership and members of the diaspora community from all over the world who are here with us for this Diaspora Day event, members of the press, distinguished ladies and gentlemen. On this special occasion to mark the National Diaspora Day 2026 and the Merit Award, as well as the dinner, I would like to congratulate the various awardees for distinguishing themselves in their various fields of human endeavor. For us, this is a celebration of the best of Nigerians. And I would like to congratulate all of you, particularly the very impressive turnout of Nigerians in diaspora who had come from as far away as Australia and elsewhere. On a personal note, I recall with nostalgia my close association with Nigerians in diaspora, NIDO, while I was first serving in Canada in the early 2000s and later in the United Kingdom for about 5 years at each of those posts. As a career diplomat and permanent secretary of the Ministry of Foreign Affairs, my closeness and awareness of diaspora matters have no doubt given me good reason to always appreciate your immense contributions to national development through citizen diplomacy, knowledge transfer, innovation, capital injection, philanthropy, and social capital, just to mention a few. As you are no doubt aware, Nigerian foreign policy, as has been reformulated, focuses essentially on the Nigerian people, which is why demography has become our primary focus. I believe is that foreign policy must impact more directly in the most impactful way on the Nigerian people. So whatever we do, including diaspora, which is one of the main pillars of the 4D, must speak to this reality. And we see today's event as an illustration of that commitment of the federal government to harnessing the resources of Nigerians in diaspora for national development. The gathering of these district professional Nigerians from all over the world is an illustration, an eloquent testimony of the benefits of migration that has continued to make significant contributions to national development. This is why we view migration, we hold the view that migration should not be criminalized, it should not be weaponized or demonized. But all of you went to various parts of the world, you are making significant contributions to those countries, just you are now bringing so much of those contributions to us in a win-win situation. It is a case of talent circulation, brain game, rather than brain loss. As the supervising ministry for diaspora engagement and international cooperation, the Ministry of Foreign Affairs does not consider our diaspora population as a bunch or a basket case of consular burden or responsibility, always in need of assistance or favor. Government recognizes diaspora as one of the nation's most strategic assets. Beyond remittances and investment, so much of which we've had this evening, our diaspora serves as a powerful bridge for diplomacy, innovation, technology transfer, professional exchange, and global partnership. This is the way we see diaspora engagement in the Ministry of Foreign Affairs. As you may also be well aware, diaspora is one of the 4 pillars. I've mentioned that. The ministry remains committed, therefore, to fostering stronger connection between Nigerian government, its citizens abroad, while facilitating collaborations to support the effort in this regard. Excellencies, distinguished ladies and gentlemen, studies have shown that the volume of remittances from Nigerians in the diaspora is far higher than the official development assistance that Nigeria receives from all the countries put together. We commend these remittances, which stand at roughly, by estimate from the central bank, about 600 million monthly and roughly 21.8 billion annually. We are convinced that these figures do not actually reflect the actual volume of remittances, much of which are undocumented. We need a more effective mechanism and strategy that will enable us better harness the remittances into productive sectors that will enable us to better derive maximum benefit from what you do and what you bring home. And talking about home, permit me to comment briefly on the effort of government to make the home front more attractive in terms of ongoing reforms of the economy, which, as you are aware, had achieved the level of stability, now moving towards concrete development that will impact more on the life of Nigerians under the Renew Hope agenda of government. So please continue to do what you do. Government is doubling its effort to make the home more attractive so that we even increase the absorptive capacity of the Nigerian economy and our population to derive maximum benefit from Nigerians in diaspora. Let me end this brief remarks by encouraging the awardees present here tonight and by sending the timid population of Nigeria in the diaspora to continue to make Nigeria proud. We are very proud of you. As Madam Abike Adabri said, you are the true ambassador, the true face of Nigerians, not the less than 1% of Nigerians that sometimes misbehave, and the whole world now use the same brush to paint every Nigerian. We must reject that narrative. The theme of this year's diaspora requires partnership. When you talk of harnessing, it requires all of you, all of us to partner and, on the basis of mutual trust and confidence. From my experience in Canada and UK, I was aware, painfully, of the lack of trust and confidence that were exhibited, particularly in the leadership. And I'm glad Madam Abike Dabri spoke about that. So unity is key. Please, unity is key. Your focus, your priority should be Nigeria, the Nigerian people, regardless of your tribe or state. That would be my major message to all of you on this occasion, unity of the diaspora all over the world. I thank you for this opportunity.
Please give him another round of applause. The Honorable Minister of State, Ministry of Foreign Affairs, Ambassador Shola Enikonlaye. And for those who probably have heard that name over and over again, what it means is that not one person owns the world. Enikonlaye. And it's a very, very beautiful name. If you want to clap, do it very well. Thank you very much. We'll take a few recognitions as I'll shortly be inviting the Honorable Minister of State for Health. But just a few recognitions. Dr. Sam Agwu is here, CEO, Enugu International Hospital. Thank you. Already you heard the brand ambassador, Enugu International Hospital, Mr. Ramsey Noah, is here with us. We have Dr. Yomi Jai, Special Advisor, Health, Enugu State, also here with us. Thank you very much. We also recognize Chief Jacob Eddy Kakai Basange, Special Advisor to His Excellency the Governor of Kogi State. Thank you very much for being here. We recognize Dr. Anthony Okechukwu Ojukwu, Officer of the Order of the Federal Republic, Senior Advocate of Nigeria, Executive Secretary, National Human Rights Commission, represented by Barrister Charity Okengo. Thank you very much for being here. And we very specially recognize the distinguished Commandant General of the NSCDC, ably represented by a very distinguished gentleman par excellence, NSCDC FCT Commandant Dr. Olushola Odumosu, who recently launched a very, very great book. Please give him a round of applause for what he's doing for Nigeria. Thank you very much. Also, we have Agidigbo FM, a popular Yoruba station based in Ibadan. And they have the Diaspora Watch program on every Tuesday between 5 p.m. and 6:30 p.m. They are here live from Ibadan to cover the Nigerian Diaspora Day Celebration 2026 and relaying it to parts of the world live. Wherever they are, please give them a round of applause. In the same vein, we recognize the Nigerian Television Authority, recognize TVC and Channels Television for live coverage of this event. Please do give my colleagues a round of applause. At this point, we now very respectfully welcome the Honorable Minister of State for Health and Social Welfare, a health practitioner par excellence himself, public health specialist. He is Dr. Isiaq Adekunle Salako. Please welcome him with a round of applause. You're welcome, sir.
Thank you. The Secretary to the Government of the Federation, our leader, our class monitor, Senator Dr. George Akume, CON, who's here representing the father of the nation, President Bola Ahmed Tinubu, GCFR, the Vice Chairman, Senate Committee on Diaspora, and also the Chair, House Committee on Diaspora, Honorable Minister of State for Foreign Affairs, my brother with the very profound name, Shola Enikonolaye. Let me also especially recognize the chairperson, the chief host of today's event, chairperson of the National Diaspora Commission, Honorable Abike Dabiri-Erewa. Other top government officials here present, members of the diplomatic corps, permit me to specially recognize our dear brothers and sisters from across the world, Nigerians in diaspora from across the world who are here this evening. Especially, let me be a little bit partial, the healthcare professionals from all the four corners of the globe, who in the last 1 or 2 weeks have been providing clinical services, performing very complex surgeries, delivering high-end trainings, and generally contributing to the realization of the vision of President Bola Ahmed Tinubu for the health sector under the Renew Hope agenda. Esteemed partners, gentlemen of the press, distinguished ladies and gentlemen. First, I would like to congratulate the Nigerian Diaspora Commission for consistently celebrating the Diaspora Day, and more particularly appreciate the focus of this year's celebration, which is on healthcare. The theme, harnessing global diaspora medical expertise to strengthen local health systems for national development, speaks for itself. Today, we're witnessing the Diaspora Health Impact Initiative, which is being implemented as a collaborative initiative between us at the Federal Ministry of Health and Social Welfare and the Nigeria Diaspora Commission. The enthusiastic participation that we have witnessed, that has generated experts in various fields of medicine, nursing, pharmacy, and so on, is another validation of the power and the reach of the Renew Hope agenda. The Renew Hope agenda, power to attract surgeons, infectious disease specialists, gynecologists, specialist nurses, and an array of health experts from virtually every continent of the world. As far as South Africa, as near as South Africa, and as far as Australia. I want to sincerely appreciate all our professionals who have come to support the health sector initiative of Mr. President. We have also seen how powerfully the Renew Hope agenda has driven this enthusiasm to reach all the 6 geopolitical zones of Nigeria, from Ikorodu to Kefi, to Sokoto, to Kaduna, to Benin, all over Nigeria, performing very, very important clinical services trainings. As complex as uterine fibroid embolization, free, which will have cost in the neighborhood of 8 million for every person. But this is being delivered free. I think our health professionals in diaspora deserve a round of applause for this. Today, again, we are seeing the power of collaboration in action. We're seeing that when President Bola Ahmed Tinubu talks about reforming the federal government for synergy, for efficiency, and for impact, it is not just talk. this is a collaboration between two agencies of government that has brought worldwide impact to Nigerians. The Federal Ministry of Health and Social Welfare is proud to be part of this partnership, and we are committed to putting institutional mechanisms in place to sustain it on an annual basis. The Nigerian Health Sector Renewal Investment Initiative under the Renew Hope Agenda is assuredly and steadily moving the Nigerian health sector to ensure that all Nigerians can get the health care they need at any point in time without suffering financial hardship. If you take a look at the Nigerian Demographic and Health Survey 2024 and the mini NDHIs of 2026 that were harvesting the outcome, we're seeing significant impact. Maternal mortality rate is going down. Infant mortality rate is going down. Immunization coverage is increasing, and so on and so forth, which clearly shows that the renewal that Mr. President has promised is indeed happening. The one key challenge, of course, that we continue to face in the health sector is human resources for health, which is being worsened by the migration of health workers to other parts of the world. Nigeria, therefore, continues to call for ethical migration, co-investment, so that there can be mutual benefit from migration of health workers. But in the interim, we have put in place policies under the migration policy, health workers migration policy of the federal government to ensure that, first, we improve welfare of health workers in Nigeria. Only in November 2025, the federal government approved new allowances for all our health workers that is going to cost the federal government about 90 billion per annum to implement. We're ensuring that we create avenue and platforms to engage our health professionals in diaspora, and this is a testament to that. We have also created a digital portal that health workers abroad can harvest and can harness to be able to contribute to the development of the health sector in Nigeria. So in conclusion, distinguished ladies and gentlemen, this is something that we are all proud of. We are particularly grateful that Nigerians in diaspora, particularly in the health sector, continue to remember their roots and continue to contribute to the development of the health sector in Nigeria. We look forward to more collaboration and more impact in improving the health of the average Nigerian. And so with peace and plenty, we pray that Nigeria shall succeed. Thank you, and God bless.
Another round of applause for the Minister of State Health, Dr. Isiaq Salako. I have the pleasure to recognize 6 members of the Nigerian and Canadian Business Network, led by Dr. Kunle Ibitoye. Dr. Kunle, are you here in the house? If you're here, we recognize you and your team. Dr. Kunle Ibitoye. I also want to use this opportunity to tell you that next month, come August 12 to 15, we have a global economic conference. We targeted Nigeria Global Economic Conference in Toronto, Canada. We invite all of you to participate and be part of that Global Economic Conference. It's happening next month from 12 to 15 of August. It's being organized by the Nigerians in Diaspora Commission in collaboration with Nigerian High Commission in Canada and Canadian High Commission in Nigeria. Both are Nigerians diasporans in Canada. So be part of it. Also, I have a Nigerian who is showcasing Nigerian colors and Nigerian name, popularly known as Omo Naija. Omo Naija, are you here? If you are here, we want to see you come and showcase the Niger colors. Make it bricks so that we see that she is residing in Ghana, is our #1 ambassador there. She showcases Nigeria. She's all over Ghana. She just flew in this morning to Nigeria. Give her a round of applause. Niger for life. Omo Niger. She's Omo Niger. Beautiful Nigerian colors. That is Omo Niger.
That's
Thank
right.
you.
Omo Niger for you. Beautiful Nigerian colors with beads and a hostel. Another round of applause.
Okay, very fast and quick. We invite the Chairman, House Committee on Diaspora Matters, Honorable Sir Tochukwu Okere, my good friend. Welcome on stage. Our dear, very dear Sir Tochukwu, always with us, anytime, even at midnight, we call on him, he comes. Thank you, sir. Thank you very much. Good to see you.
The President of the Federal Republic of Nigeria, His Excellency Bola Ahmed Tinubu, GCFR, ably represented by His Excellency Senator Dr. George Akume, CON, the Secretary to the Government of the Federation, the Chairman, Senate Committee on Diaspora, represented by my brother Senator Yaro, the honorable members of the House Committee on Diaspora, and other honorable members of the 10th Assembly. All the ministers here, the Chairman, CEO, Nigerians in Diaspora Committee, Honorable Dr. Abike Dabiri Erewa, OON, Mama Diaspora, the President of all Nigerians in Diaspora Association, Organization, and Groups, our distinguished awardees and diaspora champions, members of the diplomatic corps, our partners, our stakeholders, all the commissioners here, top government functionaries, distinguished ladies and gentlemen. It is with profound honor and a deep sense of purpose that I stand before you today to address a team that holds the transformative potential for our nation's health future, harnessing global diaspora medical expertise to strengthen local health systems for national development. Our world today is characterized by unprecedented movement of people, knowledge, and skills. Amongst the most valuable of these movements is the migration of our medical professional doctors, nurses, surgeons, researchers, public health experts, and healthcare administrators who have gone abroad in search of better opportunities, advanced training, and improved working conditions. Many of them have risen to positions of excellence and improved working conditions, contributing significantly to the systems of their host countries while carrying within them the rich cultural and professional identity of our nation. Yet, while their departure may have been perceived as a loss, I choose to see it differently. I see it as an opportunity, an untapped reservoir of expertise, innovation, and global experience that can be strategically mobilized to rebuild, strengthen, and transform our local health systems. The diaspora is not merely a group of expatriates. They are our brothers and sisters, our mentors, our colleagues, and our national assets waiting to be reconnected with the homeland that shaped their early values and professional foundations. Our approaches and framework to harness diaspora medical expertise effectively, we must move from vision to action through concrete, practical, and scalable strategies. I propose the following framework for engagement The first is diaspora mentorship and training programs. The second is diaspora investment in health infrastructure. Our actions and commitments. To make this vision real, we need commitment from all stakeholders and government agencies to start with. The National Assembly will demonstrate significant commitment by moving from symbolic support to practical oversight, legislation and partnership building, and directly connect diaspora expertise to local health system needs. To our medical associations and academic institutions, we encourage you to partner with diaspora organizations, organize joint training curricula, create mentorship networks, and open their doors to diaspora collaboration. To our diaspora communities, we encourage you to respond positively to this invitation. Register with the Partnership Council, volunteer your time and expertise, invest in health infrastructure, and serve as ambassadors of our nation's health potential. To our private health sector, to create investment opportunities, sponsor diaspora programs, adopt telemedicine technologies, and partner with diaspora professionals in service delivery. And to our international partners and development agencies, we encourage you to support diaspora engagement initiatives with funding, technical assistance, and global networking opportunities. Distinguished ladies and gentlemen, as we launch this initiative, let us remember that we're building something that will outlast all of us. The power of diaspora lies not in what they have achieved abroad, but in what they can help us build at home. I call upon all stakeholders, governments at all levels, diaspora associations, professional bodies, and the private sectors to work together to ensure the success of this initiative and to institutionalize it as an annual event. Let the Diaspora Health Impact Initiative 2026 be a beacon of what is possible when we harness the talent, expertise, and patriotism of our compatriots abroad. As we look forward to a future where every healthcare professional in the diaspora is recognized and engaged as an equal partner, let us commit ourselves to building a resilient and equitable healthcare system for Nigeria. God bless the Federal Republic of Nigeria. Thank you very much.
Another round of applause for Honorable Sir Tochukwu Okere, Chairman, House Committee on Diaspora Matters. Up next, we have the Chairman, Senate Committee on Diaspora and Non-Governmental Organizations and Civil Societies, Senator Anyeke Mbasi, here represented by Senator Anthony Yaro. Is our dear Senator, always on our event. Happy to see you. Thank you, sir.
Thank you. Your Excellency, the President of the Federal Republic of Nigeria, President Asiwaju, TCFR, here ably represented by the Secretary to the Government of the Federation, my dear colleagues from the National Assembly, honorable ministers here present, members of the diplomatic corps, and diasporans, you are welcome to Nigeria. Thank you. It is with great pleasure and deep sense of national pride that I stand before you today at this grand occasion of intellect, patriotism, and purpose. Looking out at this event, venue filled with so many brilliant medical minds for the title of this session today, 2026, from the sheer excitement of delivering this speech, I'm comforted by the fact that I'm in the safest room you can ever find in the entire West Africa sub-region. So if I get fainted by excitement, immediate attention is here. I'm not afraid. Ladies and gentlemen, I take the whole session of my colleague that presented the paper of purpose. The only thing I will add is that, as Mama Diaspora said, that we, the National Assembly, should work on diaspora voting. It's worth it. We assure you, by the next dispensation, by the grace of God, that will be done. We'll work on it. No two ways about it. I also throw a challenge to the colleagues in diaspora. I happened to be working some years back on establishing vaccine production center here in Nigeria. Let it be anywhere in part of Nigeria. Please, I will want, before I die, to live to see a vaccine center development here in Nigeria, including even the Ebola vaccines, even the most difficult vaccines you can find to produce around. I throw that challenge to the diasporans, that please, in the very near future, let's see a vaccine development manufacturing center here in Nigeria. Thank you, and God bless.
Thank you very much, distinguished. We appreciate you. Just a quick announcement, as very shortly we're bringing up His Excellency, the President of the Federal Republic of Nigeria, special guest of honor. But quickly to announce that dignitaries will visit the stand, that happens just after His Excellency's speech. So all dignitaries should please remember that we'll be visiting the stand after His Excellency's speech. We also recognize here with us very distinguished Honorable Peter Uzo. Thank you very much, sir, for joining us here today. Thank you very much, sir. Please a round of applause for him, Honorable Peter Uzo. And now, Your Excellencies, distinguished ladies and gentlemen, the special guests of honor, His Excellency Bola Ahmed Tinubu, GCFR, President, Commander-in-Chief, Federal Republic of Nigeria, ably represented by very, very distinguished Nigerian par excellence who loves diasporans. Please welcome him with a diasporan round of applause. Distinguished Senator Dr. George Akume, Commander of the Order of the Niger, Secretary to the Government of the Federation. Your Excellency, sir.
Please be seated. I stand proxy for Mr. President, His Excellency Bola Ahmed Tinubu, GCFR, who would have loved to be here personally, but is engaged in other equally important state matters. I now read his statement to you this evening. Members of the National Assembly, honorable ministers, members of the diplomatic corps, the chairman and chief executive officer, Nigeria Diaspora Commission, Honorable Abike, Dabiri Erewa, OON, distinguished Nigerians in diaspora, our partners, top government functionaries, gentlemen of the press, ladies and gentlemen. It is my honor to welcome you to the 2026 National Diaspora Day celebrations here in Abuja. This year's theme, Harnessing Global Diaspora Medical Expertise to Strengthen Local Health Systems for National Development, captures the essence of our shared vision and mission in the renewed hope agenda of our government. Let me first of all acknowledge the role of the diaspora community to nation building.
Diaspora is one of Nigeria's greatest assets. Across continents, Nigerian professionals have excelled in medicine, science, technology, and innovation. They have built reputations as some of the finest doctors, researchers, and healthcare leaders in the world. Yet, beyond their personal success, they remain deeply connected to the homeland. Their expertise, their networks, their commitment are invaluable resources for our national development. Our diaspora is a source of national pride. Across the world, Nigerian doctors, nurses, and public health leaders are saving lives, advancing science, and shaping global healthcare. Today, we celebrate not only your achievements abroad, but also your enduring commitment to the homeland. I must also commend the Nigerians in Diaspora Commission under the leadership of Honorable Dr. Abike Dabir, OON, for its tireless work in coordinating diaspora engagement. The Commission has been the bridge connecting our nation to its sons and daughters abroad, ensuring that your expertise, investments, and goodwill find meaningful pathways into national development. The Diaspora Health Impact Initiative 2026, coordinated by the Commission and Federal Ministry of Health and Social Welfare, is a laudable initiative, bringing together all our diaspora medical practitioners across the globe to participate in the development of our dear nation. We acknowledge A, the Nigerian Medical Association, B, Medical Association of Nigerians across Britain, C, Association of Nigerian Physicians in the Americas, D, Nigerian Medical Association in Germany, E, Nigerian Australian Medical and Dental Association, F, Concerned Medics Foundation in the UK, G, Nigerian Doctors Forum in South Africa, H, Canadian Association of Nigerian Physicians and Dentists. Our partners, and they include the National Association of Nigerian Nurses in North America, Nigerian Nurses Charitable Association UK, International Organization for Migration, state governments, including the Federal Capital Territory, private sector, and other organizations who contributed to the success of the medical mission across the 6 geopolitical zones of the nation. We thank you immensely. The Commission's flagship programs like the National Diaspora Day celebrations, National Diaspora Merit Award, Nigeria Diaspora Investment Summit, Diaspora Data Mapping Scheme, NIDCOM Youth Empowerment Summit, Badagry Door of Returns, and several other initiatives aimed at connecting the diaspora community to their fatherland have not only succeeded in building an all-inclusive national development framework, but have also sharpened the country's image positively among the Committee of Nations. This fits simply into the 4Ds foreign policy of our administration's renewed hope agenda, which are democracy, development, demography, and diaspora. Healthcare system challenges. We know the challenges our healthcare system faces. inadequate infrastructure in many communities, shortages of skilled medical personnel, gaps in research, innovation and specialized care, policy inconsistency, and so on. These challenges are not insurmountable. With the collective strength of our diaspora, we can transform them into opportunities, and that's what we're doing right now. Our administration is determined to build bridges between the diaspora expertise and local institutions. We are determined to, one, expand diaspora medical missions to serve communities across Nigeria and encourage sustainability of same. Two, establish knowledge transfer partnerships with universities and teaching hospitals. Three, leverage telemedicine platforms to connect diaspora specialists with patients and practitioners at home. Four, encourage diaspora-led investment in hospitals, pharmaceutical industries, and research centers. Five, strengthen and empower the Commission more to deliver excellent coordination of the diaspora engagements. Policy commitments. To support this vision, we create a platform that will institutionalize the diaspora healthcare impact initiatives to coordinate contributions, offering incentives to diaspora medical professionals who return to practice or invest, and ensuring transparency so that every effort delivers measurable impact. Therefore, I call upon every Nigerian in the diaspora to know that Nigeria, your country, needs you. Whether you are a surgeon in London, a researcher in Boston, a lab scientist in China, or a nurse in Johannesburg, your skills are vital to building a resilient, inclusive, and world-class healthcare system in Nigeria. Together, we can ensure that no Nigerian is denied quality healthcare because of geography or poverty. Together, we can make our nation healthier, stronger, and more prosperous. On this occasion of National Day Celebrations 2026, I want to use this opportunity to congratulate those that will be awarded with the prestigious National Diaspora Merit Award tomorrow. I urge them not to relent in making our country proud in their different professions and countries of residence. The reward of good work is more work. Finally, I reaffirm our administration's commitment to harnessing the brilliance of our diaspora for national development and for our collective benefits. May God bless our diaspora community. May God bless the Federal Republic of Nigeria. Thank you.
Please, a round of applause for His Excellency. We'll take photograph immediately, Your Excellency, with your kind permission. We'll take photographs, sir. With your kind permission, sir. We'll take quick photograph. Excellencies are invited to join the SGF right here for photograph. Quick photograph, sir. And then...
Welcome back from the live telecast. We'll now continue with our regular programs. Stay tuned.